in my past experience in a large telecom conglomerate, we would spend a lot of time understanding our employees by personas. We'd use data science to figure out, what similarities and differences they have. And only then is really when you can start thinking about solutions.
Welcome to Broken Benefits. I'm your host, Lee Lewis, and this is a podcast where we learn from top employer experts on how to fix our broken benefits to save lives, save dollars, and save your talent. Hi, welcome to Broken Benefits. I'm your host, Lee Lewis, and so excited to introduce today's guest. I am joined today by Steve Hoelper. He is a luminary that has been influencing our industry for many years. To give you a little idea of his background, Steve worked 20 years in digital health. He led 4 startups and worked in corporate startups and has worked in every vertical within healthcare, whether it be on the provider side, marketing side, pharmaceuticals, and the like. When he managed a health plan, which he did for half a decade, Steve oversaw the spending of over 7.5 billion with a B, dollars in healthcare. In addition to that, thanks to his efforts, his employer saved over $575 million. And today he is going to be walking us through the ways that he thought about healthcare, the ways he deconstructed it, and the tactics and strategies that we can all use while managing healthcare benefits, whether just through the benefits or as a business leader. And with that, let's bring him in here. Steve, welcome to the show.
Hi, Lee. How are you? Good to see
Fantastic.
you.
Uh, Thrilled to get into this. Want to jump right in. Steve, many people who manage health plans today don't understand or think about the problem, I think, with the same kind of multifaceted approach that you have coming from so many different areas. Would you mind deconstructing a little bit for us? What is broken about healthcare today from the vantage point of an employer?
Wow. Well, I have to say, employers do an awful lot to make sure that their employees are healthy. We know that, and it's been it's been an evolution over time. There are many challenges. I don't want to go into the pandemic for a very long time, but prior to that, there's been this process of figuring out how to get employees to engage in their own health, and that's always difficult because it's behavioral change. People are set in their ways, and there's only so much you can do as a benefit provider. So, really getting understanding the client is probably the most important thing. So, for example, in my past experience in a large telecom conglomerate, we would spend a lot of time understanding our employees by personas. We'd use data science to figure out, what similarities and differences they have. And only then is really when you can start thinking about solutions. You know, Someone who works in one business unit and we'll just say they stand all day is going to be very different than someone who's in a media role or someone who's in a customer facing role. So those things they add characteristics that people often overlook. So really getting to empathize with different groups of people and spending time with them is probably the most important thing. And I don't know how much time people spend doing that, but it's really advantageous if you're going to try to customize healthcare for everyone.
Yeah. What was the biggest surprise that you stumbled into while you were learning about this? Because I think I sort of take it for granted that I know who people are and how they operate. And I'm sure
Yeah.
you probably had some of those same biases, but once you got the data, what were some of the surprises and how did they impact the way that you managed the healthcare?
I think the surprise is if you actually go into the field and speak to people one on one. We used to do, in our team, we had a research team within our innovation product team. So we would actually have team members that specialized in health engagement. They would go interview people. They would use, traditional market research approaches like, interviewing one on one and doing surveys, et cetera. But the most important thing was getting face to face with people. And what's most surprising to me is actually when you start asking questions about how they've experienced the health plan or a specific provider, or even on the financial side, you'll start to hear individual stories that come surface. And in those individual stories about, well, I had a challenge with, accessing a lab in this state, or had a challenge with getting reimbursement for this, um, it becomes very emotional because they have personal stories attached to it. So I think one of the things that people take for granted, if you're not in the benefit space, is that all of those employees have families, they have caregivers, they have dependents, and you're responsible for all of them. So you need to make sure that you understand as much as possible. So that's like that primary research is a critical foundation.
That's fascinating. And I agree with you. I think a lot of employers don't necessarily do that. Um, this tactic, sort of thinking about it in terms of almost as a market fit kind of approach to healthcare, and looking at them in different personas and different needs of different people in different roles. That's, I think, a really good example of one tactic that you used that was different than the norm. What are some of the other tactics that your team used that would probably be considered novel
Yeah.
or very outside the norm?
So we talked about research. I think the second part of that strategy is really heavily focused on data science. So our data science team would look across a variety of data sets. So whether it's the health plan, the pharmacy plan, disability, retirement, and we'd be looking for things that are cues within our overall population. I mentioned personas before. So if you can kind of abstract what your population looks like, search for common concerns, you can do a better job at making sure you have solutions that fit the majority of people's needs. Um, the We would leverage our data science team to identify not just trends, how do these things correlate to one another if it's something completely unrelated. So for example, some findings that are interesting are, people with low 401k balances have a lower tendency to go out on disability because they can't
Huh.
afford to do a hardship withdrawal, um, or take a loan out. So that's an interesting thing that you may not think about, but it's impactful nonetheless when you think about the full story. And then remember, I mean, we're all, if you're in this profession, you're really focused on emotional, financial, and physical well-being. That's super important, but it's also super important to cut across those and look at the intersections between them all.
What made your team different from a typical benefits team?
I think our approach was, because my background is, as you introduced, I was, spent a lot of time in product development. So it was, when we stood up the team, it was, how do you build an organization that looks like a product development team within a startup? And it's, have a team that focuses on product development. And I'll explain what that is in a minute. The data science team, as I mentioned, the research team. You have an agile team that's helping to expedite things to make it go faster. Um, and change management was also a huge aspect of that, making sure that any changes are made or communicated appropriately, working with the appropriate communications teams. So when I say product development, I mean, physically partnering with a startup who has some, they may not be super mature, but they might have a very unique idea. And we would take them through like an accelerator. So we'd sign up with them. We'd figure out what their base product is and how our team members would use them. And then we
So,
would good.
oh yeah, so like an example. So you're sitting in benefits.
Yeah.
You're sort of a super customer because you guys spend over $1 billion a year in healthcare, and you're looking at all these point solutions. And so you'll find a point solution, let's say a telemedicine company that you like. You then would sign the contract with them, or this is still kind of during the negotiation process. You start moving them into this kind of startup
So it's
incubator.
a good point of clarification, because this, Lee, having worked with me before, is that benefits leaders are inundated with vendors. Inundated. I mean,
Completely.
in my
No
first
question.
week, we put together a database with a website where people could register, and thousands upon thousands of companies, and you wouldn't believe that there were that many exist.
Right.
The value in that is to look across those companies, what they're offering. You see a lot of what's good and what's not good and what could be better. I myself, previously being a scientist, I liked companies that actually took the approach of using outcomes research and validating their products. I thought that was a really good approach, and there's many companies that do that today still. But yes, to answer your question, we would we would find and vet those vendors, and then we take the ones that had the best potential and were flexible enough to do agile design the way we wanted to. So
Okay,
we get,
take just a second. I don't know anything about anything. What in the
sure.
world is agile design?
So we would use user centered design, but we do it in an agile way. So we would, when we onboard one of these companies, here's how the process would go. The first thing is, give the internal team an overview of what they do. Number two, set up some meetings in the field. So with our employees, say, hey, how would you use this? Do you think this is useful? Is this something you would pay for? Because paying for something is really the highest indicator of whether it's going to be used. So
Fascinating.
we
You
would,
asked your employees if they'd be willing to
yes,
pay their own money for a benefit that you're probably going to pay for them as a way to gauge whether or not they'd even like it.
yeah, and just remember, depending on the type of benefit, they may be paying for it anyway
Hmm,
through their premium. So that's
great
really
point.
important to understand that. So um, we would go through the process of distilling that feedback, and then we would work with the vendor, and we would invite them to come with us. We're not doing this on our own. We would distill that. We'd go through some product development, like, okay, based on what we heard, how are we going to design this? How are people going to use it? Who's it good for? Who's it not good for? And then they would go and they would sprint out the design of the product. They would show it to us, as you would, properly do every sprint at the end of it.
So wait,
And
just as a
mhm,
clarifier, then you would get feedback on how your people would like this product or
yeah,
how they might use it. And then you would go to the vendor and tell them changes they needed to make in their product.
we would work with them as a single team. So we would be on their development sprints, and we would be making, they would be showing that what they've delivered in that period of time. And why that's important is because we would do scaled rollouts. So we would do in one state or one region, et cetera. But before we did that, we would take a refined design and we would get in front of more people. And this would be a different type of research. So it's not, the concept level research. This is more like,
Mm.
here's an actual product. Let me put it in your hands, use it, and we're going to observe how you're using it, whether you use it, whether you would continue to use it, and you know take all those findings back into yet another design sprint, and we would do the same thing. So it's important to kind of iterate, get feedback before you do these launches, even in pilot areas, because this is investment, it's dollars. If it's not going to have the outcome that you want, you maybe shouldn't do it. But I just found from my experience that the outcomes that you get from solutions that you um, collaborate with them on for your population is a much higher probability of some sort of outcome that's going to benefit
Did
your
you ever run
employees.
into vendors? Did the vendors ever say, "Ah, my product's awesome today.
Yes.
I don't want to change it." How did that negotiation play out?
We typically didn't work with companies that had that attitude because um, it's not how we chose to work, and it wasn't how they would be uncomfortable working in that way. There were a couple that we kind of wrestled into uh, working in that manner. But I can tell you the ones that are off the shelf often, um, you actually, if you look at the hiring boards right now, you see a lot of people in benefits are hiring, like the vendors are hiring marketing people to do member engagement to recruit. They know this because there's only so much share of voice that happens within a corporation. So just think about this: you're a benefits person, you need to get your new benefit out, and you're competing with quarterly results for the company, bonus time. Every month there's some sort of event that's important, and there's just not enough share of voice to get the word out. So as a result, a lot of these benefits, this, Lee, they've got 3%, 5%
Yeah,
utilization,
3-5%.
unless it's
Nobody
hard
knows about
steer
them.
on like a fertility program where you'll get very good results. But otherwise, the engagement's pretty low.
I've always thought that the future of managing a health plan really is an advertising job in a lot of ways, because as we find solutions to problems, it's like, okay, we've got solutions now. We can make sure we got a great diagnosis or an accurate diagnosis for cancer or for
Mhm.
chronic pain. We now have therapists who are standing by to take your call if somebody needs to talk to somebody, the challenge then becomes how in the world do we let everybody know what to do when they need to do it and where? Okay, pulling that thread a little bit. I'm a benefits manager. I run a, I don't know, 1, 2, 3,000 life company, or even a 10 or 20,000 life
Mhm.
company. I can hire one person to help me get into this. I can't build out all these fancy teams that you had at your multi-billion dollar company.
Mhm.
What, or multi-billion dollar health plan, let alone company. What are, who am I going to hire? You're advising me. Tell me who to hire and how, and what's the kind of the first, second, and third thing that I should do to start managing my health plan better.
So it's a good question. If you're talking about an internal hire, I mean, my first recommendation is someone who specializes in data science. And I'm not saying
Okay.
analytics, I'm saying data science. So, to
Okay.
the extent that you can get access to the data, you should. The first thing I did when the role that I took was created, and just keep in mind when I started, it was me. I think the team grew to somewhere around 25 at 5 years later. But understanding the data architecture was the first task. So, where is it? Can I access it? What are the regulatory constraints about use of it? And do we have an environment to change or manipulate it? So to me, that's like first and foremost, because without being able to measure, you're not going to be able to understand whether you're performing well. If you're you I mean, you can take the word of consultants, so there's nothing wrong with doing that. I think many of them do a fine job, but I think there's some value in verifying for yourself and having some additional information to drive what your strategy could be.
Interesting. So data science person, not an analyst. And
Not
I'm a
analyst.
lay person. I don't necessarily know the difference between those two.
Yeah. So when you train to be a data scientist, I mean, part of what you do is data cleansing. So that's
Okay.
like 99% of the work that has to be done. So when I
Okay.
say data scientist, I'm talking about someone who has a statistical background and can do linear regression and analysis of variance and those types of things, because depending on what type of analysis you're doing, you're going to want to look for, you know, correlation. If you're very good, you may find causation, which is doubtful, but the point is you want to look for things that are related to one another. Is there an impact on the health plan if you make a change at the PBM? And the answer is yeah, there is. You just don't know what it is. So
Hmm.
keeping an eye on those interrelationships between your data sets is important.
Okay. Now I've got my data scientist. I'm starting to work. What are the first steps I'm probably going to be taking? Let's assume that I've got a large enough sample size. Maybe we increase it to 10,000 or more
Mm.
people, to where at that size, everybody has the same problems, right? Wildly different problems or for small sample sets. Every huge employer has the same problems. I now identify those based on what you know running $1 billion health plan. What are the tactics and the things that I've got to probably button up first?
Well, I quickly said data science, but I will tell you that if you're in a firm that doesn't have benefit administration is a huge thing. So if you don't have that outsourced, if you don't have that in control, if your benefits team is handling escalations, and if they're handling executive escalations, I mean, that
Mm,
takes a lot of time and care. So you have to, when I quickly say data science because it's something I'm interested in, I say that from the perspective of wanting to advance forward, right? So, um, returning to your
once you've got the
question,
basics covered, like we're assuming that we've got basic areas covered.
yeah. And could you remind me of your question, Lee?
Yeah. So now we've got our basic items covered. In terms of the administration, we're not just running around like
Mhm.
firefighters all day. Uh, we've hired our data scientist. We're now, I guess, getting our data from the insurance carrier and the PBM, and we
Mhm.
now have access to our data, and we're beginning to sort through it and look at the opportunities and options are there. What are some of the likely initial steps that we're going to be taking to manage our health plan and start saving significant dollars to try and get our trend down to zero?
So I think this has to do with part of where this comes from is because I've worked in, as you know, a variety of different healthcare positions and
Right.
worked in oncology and diabetes and asthma and a bunch of things. So I think, to the extent that it's always good to have some medical help. I will say that. So if, we were fortunate enough to have a chief medical officer who is wonderful and he could help the team kind of determine, okay, what are the high cost conditions? You can do this with a little research too. What are comorbids? So, if someone has diabetes, what's the likelihood of them having hypertension? So it's really kind of familiarizing yourself with the overall health of the population and figuring out if there's anything there. Now, I will say, Lee, and you and I have spent a lot of time talking about PBM strategy, is that, I look at what you can do with a PBM as a lever that highly controls the cost of the health plan. So I'm just assuming a situation where the PBM and the health plan are separate, but
Yep. And they
those.
should, I think that's the best practice to say,
Mhm.
look, if you've got your PBM and your carrier all kind of bundled together, that is not best practice. Those should be separated out.
Mhm.
Um,
So when we talk about just let's be people for a second here. So, Lee, do you go to the doctor's office every week?
no,
No. Okay. If you're on a medication, do you take that every day?
probably yes.
Probably. Okay. So just as a baseline, most people are interacting with healthcare without knowing it. Maybe they exercise. I consider that a form of healthcare.
Sure.
But medication is really front and center for a lot of people. It's kind of, I don't necessarily view myself as ill every day. I feel like I'm living with something
Yeah.
that I just have to deal with, and it's just part of my life. It's just one little thing. So when I look at opportunities to engage, I look at the PBM. So it's, this is where we're gonna have the most impact, the most touch points. So, there's navigation services that are emerging right now that I personally believe are wonderful, and part of that has to do with my personal story. I have Crohn's disease, and it was very difficult for me to get on a path that works. I'm on a biologic with some other small molecule products that actually helped me, but that took 3 years of pain.
Hmm.
So, to me, I often look empathetically at, like, let's think about people that are newly diagnosed on some condition, or not newly diagnosed. They're hypothetically diagnosed, and are they on the right treatment? Because those people, here's what's going to happen. If they have a condition where they're going to get sicker, you got a disability problem, or an absentee or a presentee problem.
That's right.
You're going to have more health plan costs because they're out of control with their so it just, and they're going to have experience physical and emotional stress through this. So I
Yep.
feel like,
Presenteeism, performance, there's a whole cascade that goes into that.
so for me, if you can master this concept of getting someone on a therapy or a treatment as soon as possible, I feel like there's a huge opportunity to make inroads there and make everyone, it's wins all around. Better experience for the employee, better outcome for the health plan.
Yeah, but my PBM does all that for me already today, right? Like they do all
Do
that
they?
today. I would probably not, right? I mean, PBMs,
No, I
if
mean,
that were
look,
being done, 80% of the market, 85% of the market is with 3 PBMs. So by logical extension, if all 3 of those were doing a good job, everyone would have experienced,
yeah, but
we all
you
be
know this.
experiencing
The
good.
PBMs are financial instruments, so it's, yes, they help people get medications. Yes, have they done a better job at getting mail order to people? Absolutely. Have they done a better job of saying, well, here's a 90-day supply, so you get a little discount? Do people appreciate that? Yes, they do. But at the end of the day, that's for kind of routine, maintenance. So what do you do for these other circumstances where people need a little extra help, or they're confused, or they're not on the right medication set? I mean, I personally feel like there should be more, to the extent that it's valuable, that laboratory results are more tied into how the PBM operates. So if I have a disease and my serum sedimentation rate is off, that means the doctor should know that, but shouldn't they get an advanced knowledge that your medication might not be working?
100%. Hard to deliver, but
Yeah.
that's exactly right. Okay. So switching gears just a tiny bit, I want to highlight something. This was published about your work. The New York Times said that the work that you did, well, first they named they named your team the most innovative employer healthcare group in the United States.
Mhm.
Secondly, it was reported that you had effectively 1% trend for 7 years. I'm guessing that's where that 575 million in savings comes
Mhm.
from. I want to be sports announcers after the game, breaking down touchdowns, turnovers, completions, etc. I want you to take that $575 million of just free EBITDA that you created. I can't imagine how much value that created for shareholders. Can you break that down? Where did that come from? How do we break those numbers out into the areas that were big opportunity, so that maybe me as a benefits manager out in the field,
Yeah.
I could learn from that and emulate what you did?
Yeah. So firstly, I can't, I can't do anything but acknowledge that, I was fortunate enough to work for Sean Levitt he was my mentor and friend. And he's a wonderful person all around. And I think many people in this industry know who he is.
Yes.
Um, and, you know, through his eyes, he saw the benefit of making sure that you put employees first. And in
Mhm.
doing so, the strategy that he employed was if you put employees first, the outcomes will materialize. So strategically, the way that we thought about things was based on that kind of aspirational mission statement, which is do the right thing and the impact's going to follow. So, you know, part of when you think about what we focused our time on, it was this balance. So yes, the cost matters. Do not we do not disagree with that. That's firstly.
Right.
Secondly, our employees and their families and dependents matter more, right? So
Yes. Oh, and to clarify on this, that 575 million, that's not just raising copays and deductibles.
no, in
That
fact,
was Oh, go ahead.
yeah,
Yeah.
in fact, that
Like
was
you said, this is critically important
that
because
was
most people
never
are saying,
done.
"Yeah,
Yeah, and that was never done. We did not have a high deductible health plan first. I mean, let's
you
start with that.
did not have a high deductible health plan,
No,
and you did not get savings by increasing deductibles, premiums,
no,
copays."
no.
You got 575 million out of the system, presumably from taking that from big pharma and hospital administrators or something.
Yeah.
I don't know, but reducing consumption that was wasteful and unnecessary.
So we were fortunate enough to have a team that looked at all of these aspects as related. So if we made a change it's interesting you say that. Are we increasing copays? Are we adding this or that? Um, we our investment strategy was we will remove copays for certain medications for chronic diseases, and in doing so save money, not cost money. Because if you study the problem, that these preventive medications actually provide more value, and you take a longer term view of this, which we always forecasted forward to make our investments make sense. So we would look at the epidemiology of our population, the health at large, and we would say, well, what does this forecast forward look like if we make this change? And that's how we would model any changes we would make. We did not take things away. I will say one of the things that, there's a bunch of companies right now that do navigation. Navigation is important. Um, it's not the only thing that helps, though. As I mentioned before, the virtual care, on-site clinics, all of those things are a piece of the puzzle. So one other thing, Lee, the way we viewed it as the network. So you can view a network pretty narrowly. You can say, okay, the network are the providers that work for the health plan, or ultimately work for us through the health plan.
Mhm.
Or you can say the network is all of this stuff together. So it's the clinic that's on your site, it's the telemedicine provider, which we had prior to the pandemic, which was still important and useful. And then how do you optimize that network? So, why do you do an on-site clinic? Well, some people do it because of convenience, but some people actually
Right?
say if you have high quality primary care, and I know you and I agree on this, is
Totally.
that the step down to specialty, the referrals, the higher quality referrals that you get, the better you'll be. So it's stopping that cost before it starts, getting people on the right path, giving them convenient access to care. Um, the other thing that we did was, and I'll tell you something fun with data science. So you all, Lee, you're in Texas, so I know you know this. So there's
Yeah.
like urgent cares like Starbucks in Texas,
Yes.
right?
And most of them are like freestanding emergency rooms. They're way
Now, yeah,
worse
now
than
they have like
urgent care.
specialty urgent care, like you broke a
Yeah.
bone, go to that specific one for that. So one of the things that, if you look at the emergency room, I think every employer at some point, or maybe still does, has either admissions or hospital readmissions challenges. Now, we don't want to forget the Obama administration actually put a hospital readmissions reduction program in place. So
Yeah.
there was some actual, at least from the Medicare perspective, there was some trend to fix that. Now,
Right.
here's what happens though. So as a business, the hospitals know that reimbursement's shifting because, okay, I don't want you to go experience this very expensive emergency room visit. So what happens is they say, okay, well, we're going to take our same emergency room physician group and we're going to make an urgent care that is it's a lower cost to operate, but we're going to staff it with the same physician group, which is what they do, right?
Right.
So ultimately what happens is the employer says, okay, I want you to navigate to urgent care. They teach people through communication, they're navigators,
Mhm.
telemedicine, et cetera,
Urgent care, not ER. That's right.
plan design. So that's been, I think, effective, although in some areas it's still the go-to. So I mean, some of that has to do with access to care, some of that has to do with culture in the area. So there's not much you can do there. So one of the analyses that we ran was we were trying to figure out through process mining. Now, process mining, if you're not familiar, is taking data with timestamps and dates. Okay. And what you do to that is you start to manipulate it in a way that I'm going to create a journey for someone who has that needs a knee or a hip replacement,
Okay.
or someone who has cancer. So we ran these two side by side. And one of the things that's fascinating is that what we found is, now these are like statistical manifestations of employee journey. We would map someone who's living with cancer. And what we noticed was that they would always go back to primary care, and the primary care doctor would be the facilitator of all these other complicated things.
Hmm.
Is that true in practice? The claims say that that's true. Now,
Okay.
are they going to a academic medical center that has a primary care doctor as part of that, and it's part of a cohesive care plan? Perhaps, but that's not the that doesn't happen everywhere. So we looked as well as someone with musculoskeletal issues. So what we noticed there is that, first of all, no primary care doctor is
Hmm.
involved. There's a lot of anesthesia, and that's
Hmm.
coded as injections and stuff like that for
Right.
it's not someone getting a knee replacement, it's someone kind of not getting a knee replacement. You see other radiology. So we started to look at this and we're like, why is radiology happening before specialist visit? How's that even possible? The plan design says that that's not possible. So what we
Yeah.
found out was, this is somewhat speculation, but what we hypothesized was that, because urgent care has more and more services, that they're essentially circumventing the fact that they had to see multiple, a
Mm.
specialist prior to. So they would go to urgent care, essentially that doctor would classify as a specialist to get a referral into the network. So I tell you that long-winded story to say the industry is always changing, and the
Wow.
providers are going to do things that are in their best interests, and the health plans are going to do the things that are in the best interests. And it's really incumbent on benefit professionals to pay attention to the market at large
Yeah.
and make sure that you're doing what you can to stay one step ahead.
Did most of your peers who were managing health plans understand that hospitals, carriers, consultants, the way those industries are set up, they are adversaries and have contradictory aligned or misaligned incentives?
I think there are some of the more senior benefits leaders definitely understand that. I think they spent when you look at some contrast, they spend a lot of time on contracts. Contracts are important. We know that there's putting
Right.
contractual controls in place, so that is a kind of strategy for cost containment. But more or less, I'm not sure how much people study healthcare at large as an industry to help make informed decisions.
It's almost more and more I'm running into, I just assume that everyone is sort of initiated on that point that, hey, although we have people that we care about, love, get along with great, they're our friends,
Mhm.
nevertheless, like your friend who plays on the opposing team, when you get out on that field, you are adversaries, even if you go, drinking together right afterwards. But on the field, you are absolutely adversaries. And that is something benefits teams are getting absolutely run over by carriers, consultants, providers, et cetera, all of whom might be their friends. They might even be on the board of the local hospital. But man, when you are running, even if you are on the board of the local hospital, if you are in the seat of running that health plan, that is your adversary because their incentive is absolutely misaligned to your own. And we don't want that to be the case. We want to build a system that isn't like that, but that doesn't exist today. What is the biggest success that you had? And maybe it's the area where you got the most savings or maybe you had
So
the
it's
most
it's
impact on
not
people.
it's not that. It's one of I just learned about this. So one of the vendors that we had worked with who focuses on um, mental health.
Yeah.
They position themselves as it's really someone to talk to. They use motivational interviewing. It's based on chat. And I was just
Yeah.
talking to this a friend of mine, and they had gone through this process of that I described, this kind of this startup accelerator, and I heard back from them that the outcomes on to how they refer to other benefits is higher
Hmm.
than they would see from other traditional navigator services. And what's interesting about that is that
Wow.
um, there's a lot of time spent with working with startups to make sure that they can produce an outcome, because at the end of the day you still have to prove an ROI.
Right.
And it sounds like for their entire book of business, they figured out and took the learnings from when we were collaborating and figured out um, how to make sure people are getting timely information that leads to better response to their call to action. So if it's identifying a
Mhm.
problem in the diabetes space, that they can get them to a service to help. To me, that I thought that was fascinating, because all of the work that was put in to study that space and figure out why people don't take recommendations from benefit navigators, and then sometimes they just fall on deaf ears and they don't necessarily take action on it. It was
Wow.
fascinating for me to see a much higher action rate. So to me, that was special, because there's a lot of time and energy going into figuring that out, and for them to have that across their book of business several years later, I think is fascinating
That's awesome. And this was
outcome.
a vendor that you found, you liked, you brought them into your
Yep.
plan, you guys worked together to create something awesome.
Yep.
I love that. I want to know about a big part of making a difference in this industry is taking a step into the unknown. It's taking a risk, a calculated risk, but still a risk. I want to know about kind of the biggest risk that you took that paid off really, really well for you guys. And also, I'd love to know about a big risk that you took, or even if it's big or small, either way, but a risk you took that did not work out, and how, and how you were able to normalize that and work through that. Cause a lot of people might, that might be a pretty nerve wracking thing. And I want to make that more normalized, more acceptable.
So one that worked out and one that didn't work out.
You got it.
I would say the one that worked out, we had a hypothesis that through leveraging some data science to target employees specifically based on their needs and do some targeted messaging to them through one of our navigation platforms, and do some A/B testing with one population being people with children, and one being people without, and running a campaign over a period of time with multiple touch points,
Hmm.
with a pretty big investment, because it was probably $1 million investment to do that.
Hmm.
Um, it ended up being very successful because we took the time to set up this campaign using data science to target, making sure we had the population right, sending those messages out in sequence, so sequential messaging. So, an email here, a phone call there. And what we ended up getting, because we had access to this data, is from click to close, so that message to a claim. When I say close in this instance, we were able to actually see that the action was taken. It's registered on the health plan as a claim, and it happened. And as a result of that, we saved much more than we spent. And it was a huge moment for the team, because we had like I said, we had done this in a iterative design way with this firm, and it ended up turning out to be a really good product offering.
So you got your whole population, you divided them up into some different cohorts.
Yes.
You prepped an email messaging campaign.
A couple different ones, just to
couple
make sure
different ones with different variations.
Correct.
You blasted those out to the populations.
So these were dependents and
you were able to track, hey, what was the close rate? And you're able to do, hey, here's 500 and 500 and see what the rate was, and then adjust, and another 500 and 500 and adjust, in order to get better and better hit rates in your communications campaigns.
And what I'm saying is that, yes, we were able to refine that, but the campaigns actually work because we could track. One of the things with communications to space, you're often left to only the vanity metrics, so sent and open. What I'm saying is we actually tracked sent, open, click through, and then all the way to the fact that this message was sent to someone who had a claim for the topic that we were promoting.
Like if it was a
flu shot, for example.
Trying a flu shot.
Simple
Okay,
one, yeah.
Great example. That's awesome. Okay, now one that didn't work.
There's many that didn't work.
That's glorious. That everyone listened to that. This is someone who is one of the most decorated health plans that has been in the last 30 years. And there were many, many attempts that did not work. That means that quantity is quality in many cases, because as you do more, you find the big hits that do work.
There was a musculoskeletal pilot that we ran, and I will just say, let's split out what success means. So the engagement was good. The people that used it loved it. It helped them to figure out, like, should I get a surgery? Should I lose some weight? Should I exercise more? Should I do physical therapy?
Okay.
And it really helped establish that relationship where someone can get through a hard time. Because if you've never met someone who needs a knee replacement, it's not easy for them. They're suffering on a daily basis. They might be taking injections. They might be taking painkillers. It's not a good situation. So that was a really helpful one. I think we looked at the size of the pilot and the cost per session, and the ultimate ROI didn't make sense. I think the cost per utilization was a little high. And just, I don't want to go off on a tangent, but I'm not one for PEPM or PMPM models. We were trying to focus on utilization models that made sense.
That's right.
I have to say, we may have failed in this case, where other people may have said this is completely fine because they're going to do a PMPM and they'll be fine with paying that amount, but we were pressing for more of a utilization model.
Right.
The sad part about this is this particular pilot was actually published in a peer-reviewed journal with fantastic outcomes. So when I say it failed, what I mean is, by any objective measure, it was a colossal success.
Okay.
But in reality, from a business perspective, it didn't make sense.
Oh, that's remarkable. Talk about sort of snatching failure from the winged jaws of victory. Depending on the way that you look at it. So kind of last question here. Give me some advice. How do I make benefits people love?
Find benefits people that love people. That's the first step. I would say,
you told me to find benefits people that love data, though, too. I mean, so unpack that a little bit.
I think you have to treat benefits as a business. It's in fact a very large P&L, whether you realize it or not. I don't want to say it's just an L like the loss side, because those rebates come back. It adds money back into the system. It's important because the CFO is looking at those numbers, and um, you are relied upon. Here's As a benefits professional, you have a dual fiduciary duty. You have one to the health plans or
Hmm.
multiple plans that you manage, and to shareholders. So to me, that's one thing to be proud of. Like, that is your role. Your role is important. The other thing is, and I will say this until I'm blue in the face, people, it is about employees, but their families are there too, and we often don't think enough about their families. So people that can be empathetic, understand the full situation, because it's not just the people you see down the hallway that are experiencing these benefits. It's their families, it's their children, it could be their children up to in their 20s. So it's an important distinction to make sure that you have people that can focus on the fact that it's a business, the fact that these are people and they have families, and the fact that you have this fiduciary duty, um, which is why I like that role. I liked working in that space because you felt good about what you were doing for people.
That's
it
awesome.
it does seem it gets lost a little when you have a lot of corporate transformation. Some of those aspects can get lost, but at the end of the day, you're still doing important work.
Totally agree. Listen, thank you so much. So much great information here as well, and for joining us today. Hey, if somebody wanted to learn more from you or reach out or connect with you or learn more about what you're doing now, what would be a good way they could get in touch with you?
LinkedIn's the quickest way. I'm happy to connect with anyone who wants to chat.
Perfect. Well, thank you so much for joining us. Thanks to the audience also. If this was helpful to you, or there's some tidbits in here that were, helpful to you in carrying out your role, please send a link or invite a friend or a colleague to be able to listen in as well. And we appreciate you for joining us on Broken Benefits. Thanks for joining us on Broken Benefits. If you enjoyed today's episode, please subscribe to our YouTube channel or on your favorite podcasting platform. Also, please share today's show with a friend or colleague. It's free to do, and it helps us spread the message to as many people as possible. Until next time.